Now to the panel generally, how would you define the role of a rehabilitation counsellor? So we've heard little bits and pieces of what people do, and that's great, but how would you actually, if we had to define it in maybe a few sentences?
I don't mind starting.
Okay, thanks, Michael.
Rehabilitation counsellors are actually a specific allied health profession and who work within a counselling and case management framework. So that's basically how we define it, but that can mean a lot of things. But the important part of that is that it's a profession, okay? And the idea is to assist people who are injured or disabled, who are socially disadvantaged, to participate as maximally as they can in life, okay, in the community. So that's the, I guess, underpinning principle behind what we do. But that takes the form that takes and how people do that, and depending on the jurisdiction, whether it's work cover, transport accident, Commonwealth versus state, or whether it's a private setting or a rehabilitation hospital, that can be done in different ways. But I guess the underlying principle is the restoration to the community and to as full participation as possible by the injured or disabled or health affected individual.
So it's about people reaching their full potential again.
Exactly,
Yeah.
yes.
Thanks, Michael. Anyone else want to say anything about how we've defined it?
I think it's important. Full potential for 80% of the population means paid work. And that people lost that message in the 1960s, and people concentrated on adjustment. Adjustment is not enough, because without work, people develop chronic pain problems, somatically preoccupied, relationship breakdowns, depressed affect, popping pills. So the highest form of participation is labour force participation. So everyone's pushing to return to work. They're a small group who, mainly psychiatric patients, who cannot handle responsible jobs, so you have to be very thoughtful with them.
So that's a major goal, get people back to work and they'll be operating effectively.
Yeah, definitely.
I think the other aspect, the other really important aspect is around the person's own goals for themselves, in that even if you take something such as return to health, we don't know what the person's health was prior to injury, and an idealised view of what a return to health might look like may not be realistic for that person. So it's really, at the outset, it's around working with the person as an individual rather than a collective. So that, I think that's the other aspect to rehabilitation counselling that differentiates the work that we do.
And Jeanette, would that kind of be the counselling role, working one-on-one with the person to get an understanding of their perspective? And,
Absolutely. I mean, the first thing as a practitioner that you do is sit down and speak with the individual on a very personal level across, broad-ranging topics to understand, who they are and where they've been and what's important to them in their life and what their goals and aspirations are for the future. And then understanding the context within which you are working with them to really come to a plan as to, how to maximise their recovery and return to work or return to community, or, resuming the life goals or the life activities that are important to them.